Right now, however, details and information that come to you from Dr. Helene Nguyen, who is here in the studio, standing behind me at the guest microphone from Feet and Beyond, 188 Mountain Avenue in Hackettstown. Good morning, Dr. Helene.
Good morning, Mike. How are you?
I'm doing all right. You had a very busy morning already, haven't you?
Yeah, it's a good start.
Well, I guess you would consider it that. I mean, here it is. It's 7:08. You've already been to, which hospital was it?
St. Clair Hospital.
St. Clair Hospital to see a patient there.
Yes.
So, and that was kind of an emergency, wasn't it?
Yeah, it was. Yeah, it's usually not this easier. Not this early.
Not this early, right?
Yes,
But medical stuff happens all time of the day and night, doesn't
exactly.
it?
There's no time.
There's
no discrimination in timing and seasoning.
Yeah, that is true. That's very true. Dr. Helene, thank you for stopping by this morning. You wanted to talk about some, health tips, winter foot care.
Right.
And the two of the things at the top of the list are, I know people are struggling with, and with this weather that we have had. And the very first one is cold feet.
That's right. Yeah, cold feet is one of very believe it or not, it's very common conditions on the patients on all different ages. You know, like we have teenager come in complain with cold feet. We have like 80 years old patients come in with complaint with cold feet. So there's a lot of things involved with that. You know, we concerned about the circulation. That's the first thing. But for the younger patients or younger populations, why you have cold feet? I mean, is kind of like, obvious at this season, but, during the summertime, people also complain with cold feet in the morning. So that's something it's worth to look into. There's some cardiovascular disease that involved with the heart and that sort of thing. So, I don't think that should be neglected. It's not abnormal to have cold feet, but sometimes it's worth to look into.
Yeah. And now you mentioned here in some of your tips an occasional warm foot soak with lavender oil. Lavender,
yes, because most of the time patients come in, they say they soak it with the sea salt, they soak it with Epsom salt. Those salts are very drying for feet. During the winter time, as we know already, our skin, not just our feet, our total skin overall has got really dry because of fluctuation of the temperature inside and outdoor.
And the lack of humidity in the house.
Exactly. So when something like that happens, I always recommend once a week, not every day. Patients feel good because they soak their feet, but not every day. Lavender oil is actually put in a coating to moisturize the skin, is prevent all the cracking and absorb through the pores, and it's help with keep all the moisture in the skin itself.
Wow, that's very good. Now that kind of leads to the second one, which was the dry feet issue.
Dry feet, yes.
Because that's another one again, and not only does not only is your skin dry, but it gets hard too, doesn't it?
It gets hard and it's got cracks and that sort of things. Dry feet is usually like we talk about dry feet and cold feet. Dry feet is usually when it's coming onto the picture is when the patients that didn't really care for their feet. They say, oh, it's cold. I don't want to bother with putting cream and lotions on there. I put my sock on all the time.
Yeah.
Why I need to do that? But it's actually winter time and sometimes summertime too that you definitely need to moisturize it. And of course, it's never too much moisturization on the skin. That's for sure.
So you just pretty much any foot lotion or
any foot cream.
Foot cream.
Cream is better than lotions because lotions have alcohol in there.
Oh, all right.
And it's evaporated during the winter time. So cream will stay better on the skin level. So that is always recommended, especially if the patient with the medical conditions. Moisturizing the skin is a must.
Now let's just talk a little bit about toenails, because one of the things you talk and now granted, people don't do this quite as much in the wintertime, getting their nails polished, a manicure, pedicure.
Yes and no.
Really?
Some patients, for me, myself, I prefer to not to have nail polish during the winter time because just let's like a few months off of get my toenail breathe, basically.
See, now that's what you're talking about, giving your toenails a chance to breathe.
Yes. So because you don't want the whole entire year have something coated on your toenail, and next thing you know, springtime, I'm ready for flip-flop and sandal season, and I noticed something's wrong with my toenail. So wintertime, I kind of premature to talk about it, but most of the patients coming in a lot of patients during the springtime, summertime that they say, oh, I didn't notice this in the wintertime, but it start out wintertime because we wear shoes and boots most of the time. It's warm, it's moist, it's dark. It's a perfect breeding ground for a lot of things.
Yeah.
So get your toenail a chance to breathe. That is actually is help. And it's also inspected as well.
Let's talk about smelly feet.
Another topic this morning.
Well, hey, I hope folks are not having breakfast at the moment. But because you mentioned the fact that, yes, I mean, it's wintertime. Nobody ever puts their feet out. And you don't go, I mean, bare feet. And, especially the floor is cold.
Right.
So nobody's doing bare feet. And that means your feet are always in something. They're always covered. And that's not good, is it?
That's not good. That's I mean, we do have a lot of patients wear socks to go to sleep with. It's a good, but it's not good sometimes because you kind of like under the cover most of the time, and you wear socks, so it's adding another layer of keep the toes all warm and toasty. It's great, but then you still have to inspect that because extra moisture between the toes, and especially patient with arthritis on their toes, they don't get that flexibility of the toes itself, so it keep all the moisture between the toes. That's not good.
That's interesting.
Yeah.
Dr. Nguyen, where do you have this information up on your website?
Yes, I'm gonna have that post it and publish it, and in the social media as well.
Oh, okay. Very good. Excellent. We are chatting this morning with Dr. Helene Nguyen from Feet and Beyond, 188 Mountain Avenue in Hackettstown. The phone number is 908-576-0880. Feet N, the letter N, beyond.com. How easy is that?
Yes.
You're on Facebook, right?
Yeah, I'm on Facebook, Twitter.
Okay.
Yep.
And you're still doing your free foot exams, yes?
Yes, we're still doing that. So that is, we had such a great success with that. A lot of patients, a lot of community members coming in and actually take advantage of that. And we give the recommendations and get 15 minutes with me, answer whatever that they have in mind and concern. So it's great. So I'm extending the free foot exam offer I'm hoping to get some more in.
All right. Very good. Excellent. So if you have any concerns, thoughts about your feet, it's no obligation way, no paperwork, as you mentioned,
right.
nothing to fill out. Just come on in and schedule a free foot exam to check
Thursday.
things out.
Yes.
All right. Very good. Dr. Helene, did we cover it all?
Yeah, thanks pretty much.
All right. Well, thank you. Thank you so much. I know it was a busy morning for you, but thank you for stopping by and chatting and bringing this information. I'll put a link. I'll put something up on our website with a link to yours as well, so people can get a hold of this important information.
Sounds good.
Have yourself a great day.
All right. Thank you so much, Mike.
Thank you. Dr. Helene Nguyen from Feet and Beyond, Mountain Avenue in Hackettstown, joining us this morning with some winter foot care tips.